Thank you, Dr. Ravi. We'll now be taking questions from the floor. Do we have any questions from the audience?
Dr. Ravi?
Yes.
Like for me, the part where fiber, vitamin, and mineral.
Yes.
On your,
in the slide.
Yeah, on the slide.
Yeah.
Please, I'm sorry. On fiber, vitamin, and mineral. What do you mean on that?
Okay, so in terms of fiber, what I mean is your portions of vegetables and fruits. So that's got high fiber content. If you can't eat, then there are supplements for that as well. In terms of vitamin and mineral, so this is an area where a lot of times you have questions because there's information out there. This vitamin is good for what cancer, and should I take multivitamins? There are other supplements, also herbs and all that. All I can say is they have done many trials on specific vitamins. Last time for prostate cancer, I always use that as an example, that's my area of interest. They thought vitamin E and selenium was very good. So they actually did randomized trials and they found that there was no difference in cancer prevention. So vitamins and minerals may be overall good for your well-being, you may feel better because vitamin B boosts your appetite, you may have that feel-good thing. Unfortunately, none of these vitamins have been shown to prevent cancer. So don't overdo it. Just take what is recommended. Most of the time, if you have your food pyramid, you know, the right amount of vegetables, 5 servings a day and all that, you should actually be fine. So with regards to whether you need supplementation, it will depend. If you have a very poor diet, you don't eat your meals regularly, you don't eat a lot of vegetables, then maybe you can take a multivitamin. But in terms of cancer prevention, unfortunately, many big trials have been done and they have not found any benefit. The good thing is sometimes for certain vitamins, too much of it may just be washed out in your urine, but for some like vitamin A too much or vitamin E generally not a big problem, but vitamin A may be bad for some organs of the body. So choose your vitamins. The general multivit can be added on, but for other diseases though, things like fish oil with omega-3 fatty acid or vitamin E and all may help like cardiovascular disease. But for cancer prevention, unfortunately, none of these vitamins in big clinical trials have been shown to be positive. Yes?
Sorry, on vitamin D, what does that vitamin D, and the fiber of breast cancer, bigger NCCS, I just want to know what is vitamin D?
Vitamin E, yeah.
For the calcium.
Oh, D, vitamin D, yeah, it's for the bone. It's for bone. So breast cancer, prostate cancer patients, they tend to have cancer spread to the bone. That's one problem. Prostate cancer patients, similarly to breast cancer patients, their hormone levels are low, so their bones become osteoporotic. So we recommend they take vitamin D plus calcium. Why? Because calcium alone will not be absorbed without vitamin D. The good thing is, if you're out in the sun, you get sufficient vitamin D through your skin. So, but a lot of people don't like the sun, it's very hot. So they have combination tablets which has both in it, and that's probably what you have been put on. Yeah, so it's for bone health.
Thank you, Doctor. Greatly appreciate.
You mentioned chemical just now. Can you comment on chemical commercial hair?
Oh, commercial hair dye, very common question. So, as of now, I don't know of any strong studies that say you shouldn't use it. Although, when you start chemotherapy and all that, we will try to tell you to avoid. The reason is hair dye, it doesn't just stay on the follicle, some of it gets absorbed into the bloodstream. And we don't know how this may interact. So that's the general advice. But there's no hard proof that that can cause cancer. Yeah. But if you're on chemo, then we'll say don't add on more chemicals. Same way with TCM as well. It's not because we think it's bad. We just don't know how it interacts with your chemo drugs. So there are many TCM practitioners out there who say this is good to support your immune system, so you can take it together with chemo. Unfortunately, we don't have studies to prove that. So in some patients, my concern is if the TCM is processed in your kidney and liver, the chemo is also processed in your kidney and liver, it will overwhelm the system because it's limited capacity. And if you stuff too many things to be processed, then you end up in trouble. Number two is sometimes certain drugs will release an enzyme from the liver which will reduce the effectiveness of the cancer therapy. That means you take TCM, it releases this enzyme, the chemotherapy concentration in the blood drops. Then you don't get the good benefit of it. Conversely, the chemotherapy level in the blood increases because of this enzyme, a different kind of enzyme by that's stimulated by the TCM, then you get toxic effects that are worse than if you didn't take it. So the general advice, if you are on, especially if you are on curative treatment, that means you are aiming to cure you with the chemo, do not take anything else. Not even, there's so many things, placenta, human placenta, soursop, and then the TCM one like Lingzi and all that. So there's so many different components. They are still trying to study to see how this may interact. For now, we don't have enough information. So if you're going to be cured by the chemo, you don't want to mess with the other things that may make it worse. Yes, sir.
Cancer marker.
Yeah.
So if it is so-called so very ambiguous, why didn't it stop put it like just like I mentioned, for those below 50,
yes,
you don't offer the
yeah. So you see, the offering is not by public institutions, it's all commercial entities. If you go to any polyclinic or even NCC, actually we used to have a cancer screening clinic up to 2010. Then when we got a lot of this information, we thought it's not ethical, because initially we thought, okay, so many people, they have all this executive health screen, the company sends them free, might as well do, right? So when they send them to a private clinic, the private clinic will do all these tests. NCC used to do it as well. Then later we realized this is not ethical because there's no evidence to support. Unfortunately, when it comes to government, enforcement, there's nobody who really puts their foot down and says, all these private entities should stop. But same like any other industry, there can always be more regulation. Yeah, so on my part, it's my responsibility to tell you what is evidence and what is correct. Because you all have been interested enough to come here to listen, so I must give you the correct advice, you see. But I'm not incentivized in any way to do these tests. But people who are, if you go to a different talk in let's say outside in private hospital, then you must always question, why is he telling this? Who stands to gain if I do this test? Now, because sometimes you must be skeptical. Unfortunately, medicine, just like many other industries, it's been commercialized, so it's for profit. So
coming back to this PSA measurement,
yes.
What is the significance of it?
Significance of PSA. So in screening,
yes,
they find that if you have risk factors and you choose to do screening, then they not arbitrary, but they have a cutoff of 4, where above 4, then your risk of having cancer may be a bit higher than the normal population. So they'll suggest you do a biopsy. That means they'll first examine you first. If you think your risk is higher, to do biopsy. The significance is PSA is released by the cancer cells. But sometimes normal prostate cells can release, but they won't release as much. So some patients may have benign prostatic hyperplasia. A lot of males have it, much more common than cancer. That's why they have difficulty passing urine around. But it doesn't mean they have cancer. It's when they get old, the prostate becomes enlarged, but it's benign, it's not cancerous. In fact, cancer less likely to cause those symptoms, because if you think of prostate as a cylinder and the tube in the middle where you pass urine, cancer grows on the outer part. So it must be very big cancer to compress on the tube. But the benign prostatic hyperplasia grows from the middle. So that one also releases PSA, but not as much as cancer. So we use that as just a rough guide to assess your risk of cancer in screening, but it's not accurate.
Is there any cutoff point that you must do for treatment?
No, so no cutoff point for treatment. But if let's say it's above 4, then you may have, we'll refer you to a urologist and they'll do a biopsy. But in the first place, you must think carefully first. Do I want to do it? Do I have symptoms? Do I have risk factors? What's my estimated projected survival? Do I want to know? And if you're not sure about this, it's okay because it's confusing. There's a lot of data. Go to your doctor and ask. Most of them should be aware of some of these guidelines. So then they'll tell you, if I do for you, are you prepared to accept this? If it's positive, you will end up with a biopsy, which is painful. And biopsy sometimes, because prostate is a very big organ, they go in through your anus, the rectum, and they do a biopsy with many needles. There's risk of infection, bleeding, and you may not get the cancer, because cancer may be in one spot, the biopsy may be in another spot, so you may be negative. So if the doctor explains to you like this, and you say, yes, I'm willing to take all these risks of these procedures just to find out, and if I find out, then later I'll decide whether I want treatment, then it's okay, then you can do the PSA screening.
Like my case, I went for a biopsy because they use a magic finger and then they found that the thing's hard.
Yeah.
So I went for a biopsy.
Negative.
But the biopsy is clear.
Yeah.
But now the PSA, sometimes it fluctuates. So,
if you're well, you don't have symptoms, and the biopsy is negative, if you think the PSA rises again, they can try again. I said, like I mentioned, there's a risk the biopsy didn't hit the cancerous area. So it may be in somewhere, hiding somewhere else, so it may be there. But if the fact that you don't have symptoms now means it's a very slow growing cancer in the first place. So if you can get it off your mind that even if it's there, it's not going to cause problem, then you can lead your normal life, it's fine. But if it gets you very anxious, then the urologist, if they search hard enough, maybe they may find something, but no guarantee. And in the process, every few months you'll be doing all these procedures. So you must know the pros and cons. At the end, you have to make that decision, you see. The doctor can give you advice, tell you what are the costs, what are the benefits, but the choice is yours. Okay, one more last question. Sorry.
Recently, I think during the colorectal month,
Yes.
I sent 2 samples. So these FOBT tests.
Yes.
And the result came back as one was positive. Okay, and well, that's one thing. Another thing is I noticed there has been a significant change in bowel habit, which is one of the signs of cancer. You know?
Yes.
Not so frequent, maybe once in 2 days, 3 days. Another observation is my 1 year has becoming sort of there's more loss of hearing, and which is listed as one of the symptoms of cancer in this small slip there. So, with all these observations, am I a potential candidate for colorectal cancer?
So, unfortunately, I'm not Superman, can see through your body. But see a doctor, most likely they recommend a scope. The hearing may not be related, but all this can get checked up. So the key thing is to see a doctor. They'll explain to you that your risks are like this. You should get a scope, and then once you get that, everything negative, you can sleep in peace. Otherwise, every Saturday you'll turn up here and you ask a different doctor who will give you the same answer.
But then if you find a positive result in a FOBT test,
It's not accurate, so it's not 100%. A lot of patients who have screening positive may still be normal. It may be from PALS. PALS also can give you a positive FOBT test, which is very common. A lot of people have PALS. So more often than not, a positive test may actually be negative for cancer. So if you're uncertain, go see a doctor, and then they'll be able to, even if you go polyclinic and you tell them you have this test, you show them results, they refer you to a gastroenterologist.
Thank you.
All right, thank you very much.